Welcome to Essential Therapies podcast. Dr. Cindy Hodgson here. I'm a physical therapist, exercise physiologist, specializing in John Barnes' myofascial release approach. And today I want to talk to you just for a few minutes about what may happen after you have had myofascial release the Barnes way. So what does that mean exactly? Well, if you've had Barnes' approach, you know that we don't force tissue. There is a lot of body work out there where you have to kind of grit through it. Do you know what I mean? There's been they're deepening into you with elbows or creating some sort of a force into the tissue that is uncomfortable. And you just know if you just can survive through that it's good for you, right? And so John would call that the old MFR, and we call that soft tissue mobilization also. So sometimes we do use those approaches mostly for a mechanical, trying to get through crosslinks, that kind of thing. But to be honest with you, I hardly ever use it. I mean, weeks could go by, maybe even months, and I may not even use that type of technique. However, when you have this gentle work done for an hour, and during that whole time, you've been relaxed and calm, and the therapist has done their work with you, you've been present, and you get up, you may not feel anything right away. You may actually feel really good right away. You might feel a little stirred up, as John might say. But maybe the next day you wake up, or that night, and you have some crazy discomfort showing up. And you don't really know what to do about that. It's really uncomfortable. As John says, feeling is healing. And so we would encourage you to feel that discomfort as much as you can. If you need to do something to help yourself get through that pain, such as an Epsom salt bath, or maybe a cold pack or a hot pack, or something that might help you feel better in the moment, by all means do that. We are certainly not here to tell you whether you should take or not take medications, although do know that when we try to mask or numb our symptoms, then we're not feeling it. I want to share a story with you. So many years ago, I had a patient come who was just a few months post-pregnancy and had her baby, and she was really dealing with a lot of sacrum and low back pain. So when she came, we were really focused on that. I think she was also really focused on the birth and so on. Well, I told her sometimes past trauma can resurface. So if you had some pain previously in your life, these gentle techniques that we're doing, of course, are non-injurious. You can tell this gentle, long-held, soft technique that we use in itself is not injurious. But if you experience discomfort, maybe 10 or 20% of the people who get this work might experience, just know it could be your tissue memory coming up of maybe even a past trauma, something like that. And I happened to go through all of this with her. I think that was maybe her second or third appointment. She came back the next week, and she said to me, "Thank goodness you told me that story, that old trauma might come up. I was in so much pain the next day after seeing you last time, and it reminded me of this injury I had." And in this injury, she had what's called an extension injury of her sacrum, that triangular bone in the low back, and the low lumbar, where wind came up as she was lifting up this box to throw into a dumpster, and it knocked her backwards. And she was in severe pain for quite a while and had to work through all of that. However, in our evaluation, she never even brought it up because it didn't come to her mind at all until that next day she was having that pain. And she realized that I had mentioned a previous injury could surface, and you're releasing that pain. So she went through the weekend, gradually got better. By the time she came to me, she said, in a couple of days, all of that pain was gone, and I feel much better than I did before. And that's an example of just one of many stories that I have heard over the years of patients who have left treatment, had a lot of discomfort, and they trusted this process. And so working through that discomfort in the best way that you can, and knowing that healing is feeling, allow yourself to go into that and to get treated again as soon as you can. And also, if your therapist has given you some self-treatment techniques, definitely try those and keep connecting with your body. Remind your body that it is safe and that it is loved and that you are doing what you can for it. Allow yourself to feel so that you can truly heal. We call this sometimes therapeutic pain, healing chaos, healing crisis, maybe a transformational pain that you're going through. But the reality is that you are getting rid of that stuck energy from your body and allowing yourself to truly heal. So thanks for listening, and I hope you get your self-care in today. And remember, you are creating tomorrow's body today.